Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. Today we're talking about orthotics for your shoes. I'm here with Dr. Abhay Patel. Doctor, tell us what orthotics are.
Orthotics are inserts that go into your shoe. Essentially what happens is they replace the tongue that the shoe comes with. And what they can do is they allow a person to offload an area that may be bothering them or causing them pain.
How does a patient know if they need orthotics, and what are some of the signs and symptoms?
Well, I think if you're having any kind of activity where you're on your feet or doing a lot of activity as far as like running, for example, or just a long day of standing and walking, you're going to know if you have symptoms of pain. You'll just not feel great in a particular area of your foot. When you come to see us, our job is to localize where that pain is, and also look for for anatomic reasons that are causing that pain. Once we determine that, we can basically work to get an insert for your shoe that'll take the stress off that area where your pain is, and that'll hopefully make you feel better and able to get back to that level of activity that the person had before.
What types of orthotics are on the market, and what kind of conditions do they treat?
So there are numerous types of orthotics that are on the market that treat numerous conditions. The two really big ones we'll see a lot are patients that have tendinitis of the posterior tibial tendon, and that's the tendon that keeps your arch up. And so those orthotics will tend to really support the medial or inside of your foot if that tendon is becoming inflamed over time and the arch of the foot is beginning to sag, okay? And a person may describe they're giving some flattening out, they've noticed. So essentially it's a buffer or supports that inside of their foot, and so that will take some of the stress off that area. Another area where people will have pain is on the outside of their foot, here as you can see. And so for those patients, maybe they may turn inside. They're the opposite of being flat-footed. So those patients who maybe turn in, they may get overload of the outer structures of the foot or ankle. So what orthotics do is they're allowed to offload that area to redistribute some of the load to more the inside of the foot. And again, hopefully that'll improve those symptoms, whether it be pain or instability.
Where can a patient buy orthotics?
Your pharmacy often now does often allow patients to buy orthotics. And that's an important issue now because these can be expensive. Affordability is a real problem right now. And so those tend to be a little bit more affordable. The difference is that when you go to an orthotist office, they will tend to make it more custom. So that may be more particularly to match the shape of your foot, and that may give you more exact the support that you need. Also, the materials they tend to use tend to be a little stronger, more supportive, and maybe a little more durable.
How does a patient know if orthotics are correct on their feet?
I think there is always an adjustment period. We do see this issue a lot, that a patient will get orthotics, and initially they'll feel weird because they haven't not used to having something in their sneaker, before. But what happens is we'd like to have people have an adjustment period to wear them, let's say, an hour a day, then up it, an hour, every other day or so till they get to their full regular day. If it's working, essentially, if it is offloading the problem and not causing too much of another issue. If the patient is having less pain in the area they were complaining about and then not having any other symptoms, then we know that's a good win. I mean, that they're doing well. However, if they may have, let's say, an issue in another area of their foot that's bothering them, then we have two options. And before we say they don't work, we may go back to the orthotist, or if the patient got them at a pharmacy, they may need more custom to try to offload that area that's the problem. So we want to maintain the benefit that the patient's having while addressing any new issue that's arise.